Hi, I'm Noel and I'm here to talk about therapy. Hopefully I'm going to be of use to you and you'll find it informative and helpful. Okay, looking for a therapist is the first thing to say is don't imagine there's something wrong if you can't find the right person straight away. And it's not necessarily about the person, but it's about the sort of skills and abilities they have. There's a lot about the confidence that you might have in somebody, but it shouldn't all be about that interpersonal stuff. The interpersonal relationship is important. I would say it's most important to find somebody who has the appropriate qualifications and professional experience and has the appropriate techniques and skills for your needs. So if you imagine there's different types of tradespeople in the world that may have a range of skills, and if you want some tiling done, you don't go and ask a painter to do the tiling for you. It's the same in all sorts of therapy. There's different types of approaches and modalities, and really the first stage is to match it. So if you've got, for example, anxiety or depression, what we call common mental health struggles, 4 out of 5 people will be depressed at some point or anxious at some point in their life, so it's normal. Then there's very clear evidence that things like cognitive behavioural therapy is very good for it. But if somebody is going to offer you some other modality that has no evidence base to help, then that mismatch will be quite difficult and may cause harm. So if you don't get what you need at first, just stop, be honest with the person. The therapist should be able to say, I don't think this is working, you're right, it's not working, let's try and figure out some other person who's got the skills that you need, and then try somebody else out. The bit about the interpersonal relationship is quite important, but that's only for longer term work more than the very short term work. So if you've got some of the more common mental health issues, anxiety, depression, etc., it's less about whether you feel comfortable with the person than they've got the skills that you need. If it's longer term work, you then might want to think about some sort of emotional personality match. And really, the key thing you're looking for, I would say, is that the professional makes you feel cared for. So warmth and the production of a hormone that's called oxytocin, and that will help generate bonding feelings between you and the person. But it shouldn't all be about bonding, but bonding is really useful for developing trust and acceptance, particularly if you've got issues around trauma or if you've got issues around sexual trauma, etc. You might want to feel that emotionally held by that person. It's very individual. It's a piece of string. How long should you stick? It shouldn't. There are sort of red flags. Like if somebody says it's going to get worse before it gets better, and it's just getting worse, it's time to get out. It's time to leave Dodge, because that's not necessarily the case. And comfortability is really important in therapy. It's really important that the person that you're working with takes account of how much discomfort you have, because it's really important that you can carry on with your life, right? So there's old models of therapy would say, and I remember there's a classic book by a psychoanalyst talking about regressing a patient to a hospital bed. That horrifies me, that whole idea. If your therapy isn't enhancing your capacity to cope with your life, it's probably time to think about whether or not it's helpful. And any sort of pain that you might experience, say through something like trauma therapy, if you're doing EMDR and you're reprocessing a difficult experience, it should be in manageable bite-sized chunks, okay? And there should be, as part of that, the safety netting around that is that when you're working with a therapist, they'll say, I expect you to have X level of discomfort in between sessions. If it gets more than that, we'll have another session to make sure that we reduce the discomfort, because it's not about being overwhelmed by this process. It's a waste of time if you're overwhelmed, to be honest. The skills that you learn in modern psychological therapy should enhance your capacity to cope with yourself and other people, enhance your capacity to deal with everyday life.